Think you know the truth about vaginal estrogen? Think again. Let's bust 5 common myths about vaginal estrogen in menopause. I'm Dr. Jen, and welcome to my channel. Thanks for coming back. I'm a hormone and metabolic health expert specializing in menopause care. So I want to dive into the 5 myths about vaginal estrogen a lot of people don't know about. Let's get into it. Myth number 1. Vaginal estrogen causes cancer. This is actually probably the most common thing I hear from women is, I was told that it's going to cause breast cancer. My mom has had breast cancer. My sister has had breast cancer, and I'm concerned about myself getting cancer. So there is a lot of good data now that supports that vaginal estrogen does not cause systemic levels of estradiol, and therefore it's really limited to the local tissues. And so even women with breast cancer can safely use vaginal estrogen, women with blood clots. And because of this risk being incredibly low, even North American Menopause Society has put in their position statement that it is safe for women to use vaginal estrogen, even with breast cancer and a history of blood clots. So vaginal estrogen does not specifically, and it is not specifically linked with an increased risk in breast cancer. In fact, a lot of people think that just because of the study from the Women's Health Initiative, and they get confused with systemic estrogen versus vaginal estrogen. That study did not specifically look at vaginal estrogen. It studied oral conjugated estrogens and synthetic progestins. So vaginal estrogen is not linked to cancer. So in this chart, you can see I actually have several different options for vaginal estrogens. And so we'll talk a little bit about it on myth number 3, which is about, is vaginal estrogen actually hard to use? But I want you to check out this chart because I also included DHEA, and I have a video specifically on vaginal DHEA. So check that one out if you're interested in both options for vaginal health, and also my video on hormone replacement therapy, a doctor's guide. Myth number 2, vaginal estrogen is only for older women. This is actually completely false. I have used vaginal estrogen for a lot of different women, postpartum women who have vaginal dryness because their hormones are now really, really low, perimenopausal women going through the hormonal roller coaster. Some women with autoimmune conditions actually have significant dryness issues. And so vaginal estrogen and even vaginal DHEA can be a great option for them. Women on certain medications can get vaginal dryness. And so things like antihistamine and antidepressants. So vaginal estrogen can also be very useful in this situation. And then occasionally you have some women who are young who are having low hormone levels and then have some episodes of dryness or episodes of burning. And even we use vaginal estrogen for women who have vulvar disorders like lichen sclerosis. And so it's incorrect to think that it's only for older women and only for women in menopause. Myth number 3, vaginal estrogen is dangerous for your heart. Actually, we know estrogens or estradiol is very important and critical for heart health. And vaginal estrogens, again, do not have a lot of systemic absorption. So using a vaginal versus a systemic, like an oral, and it does not impart any higher risk for blood clots or stroke or heart attack using it vaginally. Number 4, vaginal estrogen is hard to use. Why do it? It's a lot of mess and it's a lot. So frankly, there are a lot of different types of vaginal estrogen, and really you need to find the one that makes sense for you. It might be a tablet, it might be cream, it might be the ring, it might be a suppository. And so let's dive a little bit into that topic. So I specifically have vaginal estradiol cream here. This is called Estrace brand name. There's also Premarin. I typically don't use Premarin because I don't like the metabolites. I like the pure estradiol. And honestly, this is not that expensive. That's another kind of myth I didn't throw in there, but honestly, with GoodRx coupon, this ran $30 per month, but you can get it as cheap as $13 per month on Mark Cuban's pharmacy. So you should check that out. Make sure you use either GoodRx or the pharmacy directly through Mark Cuban, because that'll actually will save you money if your insurance doesn't cover it. So estradiol cream, this is actually comes in sort of the box, and it comes with this applicator. First of all, throw that darn thing away. It's useless. It's painful. It's uncomfortable. Sometimes it becomes a mess because you put it in there and it all kind of spills out. It's just a mess. So don't even use this. Just use the cream. And then just put a pea-sized amount on your finger and just put it on the vulva, on your urethra tissues. And especially if you're having stress incontinence or incontinence in general, it's good to actually get that tissue underneath the bladder a little bit healthier. So just use it on your finger finger in the right location. Estradiol tablets come in different doses depending on which one your prescriber gives you, but they are also just placed in the vagina. They can be used multiple times. You can even do them daily if you wanted to, but most people use vaginal estrogens 3 times a week. And then kind of as the tissue gets healthier and more robust, they kind of decrease it to twice a week or once a week. And you almost get like a maintenance dose. There's also the S-string, which is a little silicone ring that's actually stays in the vagina for 90 days. Very popular option for women because you don't have to worry about daily or 3 times a week dosing. It just stays there for 90 days. The downside to the S-string is sometimes it's not always covered by insurance, so you definitely want to check with your insurance carrier to see if that one is affordable for you. And then the last thing, there is compounding options with estradiol. You can actually combine it with hyaluronic acid or vitamin E or a lot of different options, even beeswax or coconut oil for soothing and moisture. So there are a lot of different options. It depends on what your provider and you decide makes sense for you. So overall, it doesn't have to be hard to use. It can be very simple. Just finding the right application for you is what you need to work on with your provider. So last one, myth number 5. So you have to stop it at a certain age. So a lot of that was based upon old data that said we would start hormones and they would be on it for 10 years and then we would stop them. And a lot of people even use that according to vaginal applications too. But once you start it, you can literally stay on it till the day you stop breathing. There's no reason you have to come off it. In fact, a lot of women use it for prevention of urinary tract infections, prevention of bacterial vaginosis or other vaginal infections as they age, because that tissue in the vagina really changes. So it's really important to use for not only just feeling better and having decrease in vaginal dryness, but overall prevention of urinary tract infections. So there you have it. 5 myths about vaginal estrogen. I hope that this information was informative for you. Please like, give a thumbs up, and subscribe to my channel so I can share it with someone else and you can continue to share it with your friends as well. And always please consult your healthcare provider about any specific details in this video. Thank you very much.